The duodenal switch is a sleeve gastrectomy that also adds an intestinal bypass component. So this can vary. I would encourage patients to talk with a bariatric provider regarding this, but typically it's a patient with a BMI around 50. This is one of the most high-powered weight loss operations that you can get. And I would just encourage patients to talk with us directly to see who would be a best candidate for it. So weight loss is a huge advantage. With weight loss comes resolution of comorbidities. So the more weight loss you get, the more chances you have of resolving diabetes, hypertension, cholesterol issues, sleep apnea. The procedure is also a pylorus preserving procedure, meaning that you do not get the symptoms of dumping syndrome like you would get with a Roux-en-Y gastric bypass. However, it can have other disadvantages, such as higher risk of malabsorption and nutrient issues, and I like to follow patients very closely to make sure that this doesn't happen. This procedure is extremely successful in keeping weight off. Long-term outcomes beyond 10 years are hard to come by right now, but we know that 5 to 10 year outcomes, weight loss has been kept off very successfully with these patients. Patients will meet with us pretty extensively, both preoperatively and postoperatively, to get these instructions. But our nutritionists here are great at giving lots of dietary recommendations. Patients will also be required to be on a lifelong multivitamin, and we'll follow patients very closely to make sure they don't have specific vitamin deficiencies. It can require a BMI typically around 50. However, patients can qualify if they're at a slightly lower BMI for benefits of resolution of comorbidities, specifically for diabetes. And patients that are a BMI greater than 50 can sometimes be staged, where they'll have a sleeve gastrectomy first, and then we can come back later and do the intestinal bypass component as separate procedures.